Hi, my name is Ashley Lowe and I'm a third-year respiratory therapy student at SAIT. I am presenting my project on the effects of exercise on the mental health of shift workers. The objective of my project is to explore the effects of exercise on the mental health of shift workers. More specifically, are there specific times in a day that are more beneficial? Are there certain times of exercise that are more effective? So this topic is important because 20% of the workforce are shift workers worldwide. This includes healthcare workers, first responders, truckers, field workers, airline staff, grocers, and many more. Shift work affects the natural circadian rhythm affecting our sleep cycles. Poor mental health and depression is 30% more prevalent in shift workers than non-shift workers. Adults with mental illnesses have about 15 to 20 years lower life expectancy compared to the general population. So before we dive into the topic, here are some definitions of terms I will be using throughout this presentation. So shift work is defined as working outside of the 7 a.m. to 6 p.m. Monday to Friday schedule. Shift work syndrome or disorder is when there are changes to the circadian rhythm causing insomnia, excessive daytime sleepiness, and fatigue relating to symptoms associated with mental health concerns. Mental health relates to an individual's mind and behavior and can affect a person's social and environment and physical health. Circadian rhythm is a body's natural cycle of sleep and wake times based on different time and environmental cues. And physical activity is defined as any skeletal muscle movement of the body that requires energy expenditure. And then there's exercise, which is a type of physical activity that has purposeful movement with the intent to improve or maintain specific components of physical fitness. So let's get started with mental health of shift workers. Shift work disorder is diagnosed in about 10% of shift workers. Shift work can affect a person's sleep quantity and quality, causing staff to be fatigued and less attentive to details. Think of the number of times we work collaboratively with other staff in the hospital to boost patients, transfer patients, turn patients, and even within our cohort, we do handovers between breaks and between shifts and everything. And if anything is missed or not communicated well when the staff are fatigued, this can lead to increased risk of injuries to the staff members and even to patients. This is equally a problem for ourselves and for our colleagues if they are not moving at the same pace as you state. You may end up straining your body, or they may end up straining their body, and either of us could get hurt, or even the patient could get hurt. Truck drivers or field workers, same idea. If they are fatigued, their focus is not top-notch, and it affects their driving and their attention to details, and that can result in injuries and even death. So fatigue, as I keep saying, is characterized by performance lapses and workers experiences difficulty keeping their eyes open. When fatigue builds up day over day, weeks over weeks, months over months, it becomes chronic fatigue. Chronic fatigue can correlate with the desynchrony in a circadian rhythm due to shift work disorder. So absenteeism increases when shift workers feel like they can't physically and mentally be present at work, ineffectively being able to perform their duties. This in turn can increase the healthcare facility's costs due to sick time, possibly injury pay, and that injury pay could become a short-term to a long-term disability leave. In addition to that cost for the facility, it would include hiring and or paying another staff member to work those missed shifts by the fatigued staff member. So this constant daily fatigue and stress can increase, and if the worker is not coping well with the fatigue and stress when they get home, the irritability and stress levels can continue to rise with commitments at home, with family members in the same house, and or daily chores. Then they would take this buildup of irritation and sleep, resulting in a poor sleep quality and quantity, all to wake up just in time to go back to work with low energy and more fatigue and adding more stress to work. And it becomes a vicious cycle, as you can see on the right side in figure 1. And as it builds up day after day, if this cycle isn't broken, then that becomes a negative cycle, increasing mental health. So exercise and mental health. So with exercise, the Canadian Physical Activity Guidelines for adults 18 to 64 years, which is the typical working age, is to have about 150 minutes of moderate to vigorous intensity aerobic physical activity per week in sessions of 10 minutes or more. This equates to less than 30 minutes per day. If we ask a shift worker if they exercise every day, they'd likely say yes, because they're moving around all the day. And that's movement, that's exercise, that's movement. But we actually use the term physical activity and exercise interchangeably when we know the definition really is not the same. Like I had stated in the definitions, they're physically active. Healthcare staff are physically active, but they're not always also in bouts of 10 minutes or more. Hopefully not. So outside of a shift worker's working hours, it is preferred to have the worker be physically active, doing aerobic exercises regularly as well. So exercise has been shown to help people who are under daily stressors, especially those with mental illnesses or underlying illnesses. They specifically say aerobic exercises have been shown to help with mental health in reducing anxiety and depression and enhance one's well-being with releasing endorphins during exercise. Endorphins provide a euphoric-like effect similar to morphine without the addiction or dependence component. Endorphins interact with the neurotransmitters, as we know, from the brain to act as an analgesic to diminish that perception of pain. So studies have found that people struggling with the mental health have difficulty finding motivation to participate in physical activity. So some ways that we can increase motivation is to build a support system to increase physical activity levels. And the support system could include simple one friend, multiple friends, a family member, multiple family members, colleagues, or even a community group. These can all increase an individual's motivation and accountability to exercise regularly. Activities such as group exercises have been found to have the most benefits in improving mental health for anybody. So fitness centers offer group classes such as weight training, swimming, cycling, and dancing. Community groups can also have outdoor walking groups, and even mall walking groups or going into the mountains walking groups. Even gardening is classified as an aerobic exercise with digging plants, pulling weeds, mowing the lawn, because you're pushing and pulling and digging and using those specific muscles. Those are all classified as aerobic exercises that they can partake in and involve family and friends and community groups. For the combination of exercise on mental health with shift work, Youngstead et al. Found that exercise had a great influence on the circadian system in conjunction with light exposure for shift workers. Our bodies are used to feeling more awake with daylight and more sleepy with less or dimmed light because our body starts releasing melatonin when it starts to get dark to make us more sleepy and fall asleep. When shift workers need to sleep during the day to work a night shift, their light exposure needs to be altered. In the hospitals, light is dimmed in the evening and overnight to accommodate for patients in the units, and this can help staff working there to maintain a normal rhythm with their families and friends, working the normal schedule of 7 a.m. to 6 p.m. Conversely, though, lights tend to always be bright in the units that are busy, such as the emergency department, because there's always patients coming in and out of the hospital. This increased exposure to bright lights at night interrupts the shift worker's normal circadian rhythm. And because our body reacts to light exposure, Youngstead et al. Found that avoiding exercise in the afternoon or the exposure to intensely bright lights can affect the circadian cycle positively, which can minimize some of the mental health effects of shift work. A study found that unsynchronized circadian rhythms had poor sleeping patterns, causing increased levels of fatigue and decreasing likelihood of regular exercise and resulting in shorter and poorer sleep. So that's that vicious cycle that we were talking about before. In some ways, that can help mental health effects for shift workers are coping strategies and exercise. Many papers commented on coping strategies as not topics discussed during a shift worker's educational career. So depending on the institution, when a shift worker encounters a stressful situation or a situation with an unfavorable outcome or a messy process to a favorable outcome, that can slowly eat at the worker's mental stress. An unorganized or unsupported debrief session would not be beneficial for that stress worker either. So some papers discuss that institutions should ensure strong and supportive debriefing sessions after traumatic situation as well as counseling being offered to those employers at the time, then so that they have resources to de-stress for themselves. And exercise, we had already discussed. Aerobic exercise can release endorphins to help physical and mental health. Limitations. There were some limitations that affected this topic, including very little studies focused on the combination of exercise on the mental health of people working shift work. The most common studies are the effects of exercise on mental health. Many other factors can play into the shift work's mental health, such as family's medical history, socioeconomic status, sex, and age. For this project, specific types of mental health were not specified because the paper did not specify the mental health diagnoses, so there was no way to choose specific topics or mental health diagnoses to narrow the topic a little bit more. In conclusion, more research should be conducted on the effects of exercise on the mental health of shift workers. Based on the studies that were discussed in this project, exercising regularly is likely a positive contributing factor to decreasing the risk of developing mental health issues in shift workers by attempting to normalize the circadian rhythm. More specifically, those working shift work throughout the night are best to exercise outside of those afternoon daylight hours to delay the shift in the circadian rhythm.